Hello, everybody. This is Dr. William Song from Omni Aesthetics. Today, I'm going to talk about our newest laser, the Junera lasers. There's been a lot of questions. People are naturally very curious about what it is, how it works, and whether it is a treatment that is appropriate for you. So, what I'm going to do today is just explain how we got here and what it does, and then we'll take some questions at the end to see if uh, people have questions about the genera. So, to begin with, let me just tell you how we came about getting the genera treatment. So, I've been working with facial aesthetics for almost 20 years now. We started back in 2007, and we started with doing simple laser treatments like IPLs and laser hair removal. Then we started getting into skin rejuvenation and skin tightening. So, what the IPL laser did was it helped get rid of the pigmentation and blemishes on the face, but people wanted to do some skin tightening and more aggressive resurfacing as well. So we got the CO2 resurfacing laser, and we decided to go with the fractional CO2 laser because with laser resurfacing, the way it works is you deliver laser energy to the skin. And when you do that, it creates a very controlled injury to the skin. And by creating a controlled injury, it allows the skin to heal and for new collagen and new skin to replace the old skin. And with that treatment, it was a nice treatment, but there was a lot of downtime because you were actually burning off a layer of skin and allowing new skin to form. And there are some complications when you do that. You could get scarring, hyperpigmentation. You have to really stay out of the sun for months, really. And when it finally heals, you can get some nice improvement in the wrinkles and you get some skin tightening too. The other way to do this is a deep chemical peel. We can use different chemicals to cause a chemical burn on the face. And by doing that, same thing, you're eliminating the surface layer and allowing new skin to form. And as that occurs, new collagen is occurring and skin tightening will occur as the new skin comes in. So the problem with these treatments was that there was a lot of downtime. And, 20 years ago, that was an issue. And today, people just don't have time for any kind of downtime at all. So we rarely do the CO2 resurfacing or any kind of deep chemicals. The laser that we do is a fractional laser where we, instead of resurfacing the whole surface, we're putting little dots of laser burns on the face so that we can get that laser energy into the skin without destroying the whole surface. And that decreases the downtime. But still, there was downtime. So we looked at other technologies like the thermal therapy. They keep trying to come up with ways to deliver energy into the skin. Now, if we do it without actually damaging the surface of the skin, we can get skin tightening without damaging the surface, and that'll give us less downtime. So what we started with, we kind of explored the non-invasive therapies, and what we decided to do was the old therapy, which is a focused ultrasound. And with that treatment, we delivered energy into the skin using sound waves. And we did get some nice skin tightening, but what we were seeing was it was hurting the fat. And quite frankly, the amount of skin tightening we got with that treatment wasn't worth the cost and the pain that was involved. And so since then, there's been other treatments that we've tried and looked at, but we felt that we really needed to do something that was going to give us more consistent result. So we started going into the subdermal energy treatments, and we had a smart lipo machine that we were using to do liposuctions, and specifically we used it to deliver laser energy under the skin to tighten the skin when we do liposuction. and it worked for tightening the skin after liposuction. And they did have a small handpiece for doing places like the face and neck, but it was a little too aggressive. There was still a lot of downtime with that, lots of swelling, and with trying to put all that energy into very delicate areas like the face was a little bit dangerous. So we didn't do a lot of them because it was, again, not so precise. So then we started working with radio frequency energy, delivering that under the skin. And we did the thermitite, which was an excellent treatment because it was more precise and it gave better skin tightening than the smart lipo laser. But we really liked the way that the laser tightened the skin. The radio frequency energy delivered under the skin gave us nice tightening, but we couldn't precisely melt the fat and sculpt. So that's a treatment that we have been continuing to do until recently. There are treatments that you might be heard of that are similar to that, like the skin tight. And then the Renuvion came out. This was a combination of radio frequency energy with helium gas, and that gave us the best skin tightening by combining the regenerative properties of the helium gas and radio frequency. We were getting some really nice skin tightening with that, especially when combined with liposuction. The problem with the Renuvion was it did use helium gas to you had to inject the gas in, and it caused blowing up of it meant insufflating the area with the helium gas, and when you do that to the face, you get a lot of swelling. So that was again a treatment that we do and did, but wasn't something that we could do every day because there was downtime involved with that. And then I started seeing uh, a new development in the lasers. They actually miniaturized this laser. You can use different wavelengths of light, and one interesting technology that I saw was a little laser fiber that went under the skin, and they used the laser wavelength that could melt fat under the skin. So we can do that to treat like the jowls and areas, treat little areas in the skin. The other energy that they use was a skin tightening wavelength, and that combination was getting close to what I imagined in my wish list of what a laser did. And then we came across the Junera. It has two different wavelengths, one for melting fat and one for tightening skin. And it was the exact wavelength that I found was the most useful in both melting fat and tightening the skin. So I started working with this company as they developed different protocols, and I finally got my hands on that laser, and I was really blown away with the results. We've been treating faces and necks with minimal downtime. I mean, you can make it more aggressive to get more significant results, but the real benefit of this laser is that we can lower the energy so that we can get very little downtime and reduce the risk of things like burns and nerve damage by being able to precisely control the energy and direct exactly where it's going to. We're able to limit the risk of complications, and we can repeat the treatment if we need to. So we are able to do this and deliver very precise treatment. So let's take a look at what I've been talking about. So if you look at this diagram, it shows how we typically did a laser treatment. And this is a fractional laser treatment where we would use a laser to basically burn holes into the skin. And when the laser is delivered through the skin, most of the laser energy is going to get absorbed at the surface of the skin, and it's going to cause a little burn. And as it goes deeper, the energy is going to start to dissipate, and the amount of energy gets lower as you get deeper into the skin. So you create this cone shape where you can reach the deeper part of the skin and have energy delivered there. That's where we can get the skin tightening to occur. But in order to go deeper, we have to cause more destruction on the surface. So what the Junera laser does is it completely bypasses the surface. We make a little entry site, basically a needle hole, and insert the fiber under the skin into the subdermal layer where we can deliver that energy. And because we don't have to break through the skin, we are able to deliver higher amount of energy, enough energy to cause skin tightening without destroying the skin. So that's how we can get almost no downtime, just some swelling. You won't see the laser marks or anything like that on the skin. So if you look at these two diagrams, on the right is how we delivered energy under the skin with the Genera. On the left is how we deliver it with a fractional laser. And you can see on the surface, there's almost no telltale mark of the laser going in because it's all under the skin, just some redness and some swelling. Whereas on the left here with the laser, you can actually see these little laser burns, which will heal, but it could take a while. We can even combine it. We can even do a light fractional laser to get rid of the surface blemishes and deliver the deep laser with the Genera, and that way we don't have to cause all that destruction on the surface. And that's a great combination treatment. So there's a lot of things that we can do with this. So here is an example of a patient that we treated with the Genera. And here we actually did her whole face. We did around her mouth where she had a lot of skin wrinkling and laxity. We did under her eyes. And the picture on the right here is a week later. Okay, so you can see that she still has some swelling, but we're already starting to see the skin tightening and the improvement that we get with this treatment. And here's a patient that we did. She was actually one of the first patients we did. And this is about a month after the treatment. So you can see that there is, at this point, all the swelling's gone. The skin tightening could take months to see. But already a month later, you can see that the skin is getting tighter and you're actually seeing some volumization because the collagen is forming under the skin. So even though it's delivered under the skin, the results can be seen on the surface as well. And an interesting thing with this is because it's causing a healing of the skin, we actually see improvement in things like hyperpigmentation as well. And here's her neck. You can see some tightening occurring on the neck, so it's a great treatment for the neck. And if you don't have like a lot of laxity, then we could potentially avoid surgery by doing a treatment like this. Here's another treatment of a neck, and you can see it's getting some nice treatment. Now, keep in mind that this is not going to replace a facelift in someone with this amount of laxity. But if somebody has very minimal laxity or just are not ready to do surgery, this is a great alternative to get some tightening without having a lot of downtime or just having to go through surgery because not everybody wants to go through that. This is a picture of an abdomen. Now, when we do liposuction on the abdomen, especially for people who've had previous surgery, there's scar tissue under the abdomen. And even if you've had non-invasive treatments like cool sculpting, it creates some scar tissue under the abdomen. It's very hard to get it smooth. So sometimes we're left with lumpiness and loose skin there doing the liposuction. And in the past, we really did not have a great way to treat it because with something like this, we could try to do some very minimal liposuction to try to correct that. But it's very hard to get it smooth when there's scar tissue there. And what we're finding is that with the Genera treatment, we can actually go in there and target the little tiny fat pockets and tighten the skin. So we can use this for fine tuning after liposuction. It's a great treatment for that. So those are some of the things that we're doing with the Genera, and we've actually been treating a lot of patients with this. We've had a tremendous amount of people interested in it, and we're actually one of the leading practices in the number of Junera treatments that we've done since they introduced it. So that's our Junera treatment, and it is our latest laser that we have. Although this is our newest machine, this is not something that's new to us. We've been working with this type of technology for almost 2 decades, and this is just the evolution of a treatment that's been very exciting, especially now if we combine it with some of the treatments that we do with like PRP treatments and our autocore treatments and even fat transfers, we can get some amazing results with this. So yeah, so now I'm gonna see if there's any questions. So Fiona, were there any questions for us?
Yeah, let's go through. Let's first start off since it's now the warmer months. Can we do Junera in the summer?
So yeah. So with laser treatments, we've been kind of conditioned to tell everybody, oh, you can't do laser treatments in the summer because if you do a laser treatment that burns the skin, then you're putting yourself at risk for the wounds not healing, hyperpigmentation, things like that. So with the surface lasers, we used to have to wait until all the tan is gone, and then after the treatment, you'd have to avoid the sun for months. So the nice thing about this treatment is we're not treating the surface directly. We're going under the skin. So it is a treatment that we can do in the summer. Now, I have to say that, as you know, the sun is one of the worst things for your skin. So even though the treatment itself is not going to be affected by your exposure to the sun, if you're going to do this, you're investing in yourself. So you want to protect your skin from the sun because you don't want to do this and just undo all the results by have letting all that radiation ruin your skin. So this is a chance for you to get a fresh start, protect your skin, and maintain the results for years.
Yes. Now, I know you spoke about this before and how it's different than a regular laser, but is this something that people need to repeat, do a series of, or is this more of a one-time treatment?
So this is not a treatment that you have to do a whole series of to get the results. Okay. It does take time for you to see the full result, but it's intended as a single treatment. And so you would do the treatment and we just would wait for the results because it'll keep getting better because it's relying on your own collagen to come in. So after doing one treatment, you'll continue to see the results improve for months and months, and the results will last. So, having said that, some people will start with treating like one area and then decide to do another area, and we can certainly do a different area. And then if you wanted to get further results, typically before with some of the more aggressive subdermal lasers, we would not want to treat it again for at least a couple years. But with this, yeah, you can actually, if you wanted to reduce a little more fat or get a little more skin tightening, we want to wait and to see how much tightening and that we can get with this treatment, but we can repeat it if we need to. But it's not intended to be something that's done in a series.
Okay. So, what would the downtime look like for someone who's getting Judera?
So with this, the downtime is going to be less than with a surface laser because you're not burning the skin. We're going under the skin, and that's going to cause some swelling. And there's potential for bruising. Usually it's not terrible, but you can get some bruising because we are going under the skin. We're using a little needle hole to go in. So the downtime usually involves some swelling and bruising. Usually for the first week, you're going to have noticeable downtime. So you might not want, I mean, if you can, kind of lay low for the first week. That'll be best. And if we're doing any fat melting in the jowls and things like that, we're going to have you wrap your skin so that We can maximize the tightening and make sure everything tacks in. And then the swelling, you might still have some persisting swelling for another week. So I would say after 2 weeks, you're good to go.
And when you spoke about doing face and neck treatments, and also you showed an abdomen, what areas of the body can we treat with the Junera?
So with the genera, we can pretty much treat almost anywhere in the body. The face is going to be the most popular. So the most common areas that are treated with this are the lower face and neck. Okay. But we can also treat under the eyes. We can treat above the eyes, the temples, and even give you a lift of the whole face. We can treat, again, the abdomen is a very popular area to treat. We can treat thighs for a condition like cellulite. I'm not going to say that this is a, definitive treatment for cellulite, but sometimes what we think of cellulite is actually skin laxity. And we've had some great results treating thighs with this treatment. And then for people who do have true cellulite, we can combine it with a treatment like Avali that cuts the bands that causes the cellulite dimpling. So it's a great treatment to use in combination. And it's also great for treating little pockets of fat. So if you had a little pocket of fat under your chin, we can do that in your armpits. So where it's so small, you don't really want to do liposuction, but this is a way you can go and melt some fat without actually sucking it out. So this is a treatment that can be used in a lot of places, and we're doing some clinical trials within the different centers for different treatments. Some like doing like a non-surgical breast lift. That's a treatment that looks very promising, and we're also using it for treating like laxity in the vaginal tissue and things like that. So there's a lot of exciting new treatments that are being explored.
So, what's the best next step for someone that's interested in learning whether they're a candidate for a Junera?
So the next step, if you're interested in this at all, is to schedule a consultation with us because there are a lot of people that were not candidates for other treatments before that might be a candidate for this. And there are some contraindications. And if I do a consultation with you, I'll be honest, like some people are just not going to be good candidates for this because there's just going to be too much skin laxity. And I'm not going to try to treat somebody who needs surgery. If I think the best treatment for you would be a facelift, I'm not going to hesitate in telling you that that would be your best option. Now, there might be reasons why you might not want to get a facelift, and the results are going to actually be the best if you do the surgery and then come back for fine tuning with this. But the consultation is what's really going to help us determine whether you're a candidate for this and what kind of results you can expect. And I want you to have realistic expectations because I'm not going to promise you that we're going to do this treatment and we're going to take 30 years off for you. Although some people it might seem like it, but we'd love to talk to you. My staff they've been working with me right from the beginning. So anybody on our team can talk to you about it. But you can certainly schedule a in-person consultation or even a Zoom consultation.
Perfect. That's all the questions we have today.
Okay, well, I want to thank you for joining us today. And if you have any questions, don't hesitate to call us. And we're going to continue to do this webinar series to talk about all the different treatments that we have. Bye for now.